Nigeria's been battling with high rates of infant mortality for decades. Until recently, it ranked among the top 10 worst countries in Africa in which to give birth. Healthcare experts point to limited access to prenatal care, lack of breastfeeding, and the prevalence of preventable or treatable diseases like pneumonia, malaria, diarrhea, and measles. But all that is changing. A report released by UNICEF and the country's Bureau of Statistics show the rate of infant mortality has dropped from 97 per thousand live births to 70. This means 27 children out of every 1,000 are being saved. It's significant progress, but the figure is still above the sub-Saharan African average. Healthcare officials attribute the improvement to government initiatives.
The scope of the types of vaccines being used is being increased. You would realize that even vaccines like pneumococcal conjugate vaccine, the federal governments have introduced it free. And you know, pneumonia is the #1 killer now worldwide, particularly in sub-Saharan Africa, and that vaccine particularly addresses that. Then the other issue, of course, is nutritional support.
While healthcare officials have managed to decrease the number of deaths of children under 5, they still struggle with high neonatal mortality rates. Most of these cases are in the northeast, where millions of displaced Nigerians face starvation.
The drop in neonatal mortality over the last years has remained the same. In 2003, about 40 children per 1,000 die before the age of 28 days. That improved a little slightly to 38 in 2008. In 2013, it's about 37.
Most child deaths happen in low-income countries, the bulk of them in sub-Saharan Africa. Authorities say Nigeria needs to invest heavily in healthcare infrastructure and awareness campaigns, especially in rural areas. Kelechi, Emekalam, CGTN, Abuja, Nigeria.